Hello, everybody. My name is Chancellor Jensen. I'm a simulation operations specialist at the College of Osteopathic Medicine of the Northwest, or COP Northwest. It's my pleasure to introduce you to the Simulated Medical Readiness, or SMART Lab, located in Lebanon, Oregon. As we begin, we must always ask ourselves, why simulation? And this commentary from the Public Health Journal summarizes that very well. And in the last 2 decades, there's been enormous growth in the use of clinical simulation. And this teaching learning methodology is currently one of the primary tools used in the training of healthcare professionals. Clinical simulation is in tune with new paradigms in education and is consistent with educational theories that support the use of experiential learning in attaining desired outcomes. We utilize that here in the Smart Lab and stay within our own goals here. Our goals being to build a state-of-the-art lab that will be recognized among the nation's top healthcare simulation learning centers. We do this by combining simulated patient encounters, mannequins, wearable technology, and virtual reality within our own learning environment, all aimed at producing sustained learning. Comp Northwest will train students to be among the most prepared graduates and future residents in the nation. In addition, it will position Comp Northwest as a premier academic site for students, residents, and physicians all across the Pacific Northwest. We can go ahead and introduce you to our team. I'm here on the left as our simulation operations specialist. In the center is our medical director of simulation, Dr. Derek Sorbeed. On the right is our department director, Kelly Mack. Inside of the sim lab, we have a few different types of simulation events. This top one here being scenario-based simulation. And these scenarios are built around things that our clinical faculty and clinical experts actually see out in the real world, in the field, and in their own practice. These utilize team steps principles, if you're familiar, and include all kinds of information to help simulate the environment of seeing an actual patient. We also have task or skill training. These train specific skills or a set of skills and will oftentimes use a piece of equipment that's designed specifically for them. For IVs, for instance, the trainer for that is simply just an arm. Things like that to train the specific skills until the proficiency is achieved, which can then be implemented into a scenario. We also have SP simulation, and SP stands for standardized patients. Standardized patients are actors trained to reproduce a patient scenario. They learn the symptoms, what to say, and how to feel. And we really like to utilize standardized patients here in our lab because Western U prides itself on its humanism. And the best way to implement humanism into these clinical teachings is to put a real human on the bed. Our standardized patients, many have been with us at the university for almost 10 years. They are professionals and very great at what they do, and they really elevate the learning experience. The next thing here is mixed modality, which is utilizing a combination of things. So you can imagine we might have a standardized patient wearing a task trainer for heart and lung sounds, or a task trainer for the IVs in the room, like I said before. Things that you might not want to do on an SP, but are still part of the actual scenario. We also complete a lot of outreach activities. These are oftentimes extracurricular learning events. We utilize a lot of outside hours with our clubs that want to elevate their learning to new horizons outside of the curriculum. We also provide tours and certifications and trainings in the lab whenever available. Here's the floor plan of our sim lab, color coded for everyone. Up in the top, we have our skills lab, and this is a multi-purpose space. We use it for skill trainings, debriefs and pre-briefs, as well as group works. We can comfortably fit about 25 students into the skills lab at a single time. Along the left side, we have our patient rooms. These patient rooms are set up in a way to emulate a hospital environment. At the very top, we have our OB room. This is equipped with an OB bed and a bassinet or a baby warmer. All of our rooms have head walls and monitors and IV poles as well. Patient rooms 1 and 2 are set up as standard hospital rooms. So they have standard hospital beds, and again, head walls, IV poles, and monitors. In the bottom right, we have our ED, or our emergency department room. This is a military style emergency department with 3 beds. Again, all the beds have head walls, monitors, and IV poles, but we also have things like transport gurneys for ambulance-based simulation, as well as skeds and litters for types of trainings that we may be doing outdoors and learning how to transport patients into an emergency department. And then up in the very top right, we have our operating room. We have a full operating table, operating lights, head walls and monitors, and a whole host of operating tools available at our disposal. Speaking of tools, we have just a light list here of the kinds of equipment that we utilize here in the sim lab. Um, we have full body mannequins of multiple skin tones and varying degrees of trauma in some cases. Our full body mannequins are fantastic. They breathe, they blink, they have pulses, they have heart and lung sounds. Some of them can lose limbs. One single full body mannequin, in the case of the Laerdal ones, can teach almost 300 skills all on its own. We get to elevate that further with things like our wearable heart and lung sound monitors or our programmable ultrasound shirts. We also have over 60 task trainers for a myriad of skills available to teach here at the Medical Simulation Lab. Aside from the teaching equipment, we also have a lot of real equipment as well. Head walls with simulated gases, but they do pump. Our patient monitor carts. We have ultrasounds and glide scopes. And part of the great thing about the simulation lab is we utilize as much real equipment as possible. The ultrasounds are real, the glide scopes are real, the needles and the tools, they're all real equipment. And this allows our learners to become familiar with what they will see out in the field, and that just elevates their proficiency. So going through kind of our spaces again here with a couple of pictures of different learning events that we've done. This is in our skills lab. So we have individual skill trainings taking place here. We've got our intubations here on the left, CPR in the center, as well as some central lines up in the top right. Our skills lab really is a multi-purpose space that we can form to fit whatever kind of utilization that we need to use it for. In our OB room, we're able to do birthing trainings, just like the ones that you see here. These are task trainers. We do have a full body mannequin that can give birth, and the infant that it gives birth to is also its own simulator. It's quite amazing to see. And we can do very simple births, but we can also, with our task trainers, our mannequin, do more difficult deliveries. We can do things like shoulder dystocia, breech deliveries. We can even perform C-sections on our mannequin to make sure that our students are prepared for anything and everything that they may see out there after their learning is completed. Both of our hospital rooms are fairly bog standard hospital rooms, normal style hospital beds. You can see the head walls and the patient monitor right there. Anytime that we're utilizing a mannequin or we're in a scenario, patient monitors will be active with exactly what will be reflected by your patients at that time. Our rooms are all video capable as well. You can actually see a camera up in the top left of the screen there. This allows faculty to view the recordings, but it also allows our learners to go back and view their own recordings to see where they may have gone wrong, what they did well, and where they can improve. In our emergency department, we like to get a little messy in here. We offer a lot of Stop the Bleed trainings and certifications. Pretty much all of our all of our students before they head on rotation will be Stop the Bleed certified on top of the other certifications that you'll be getting. And inside of our emergency department, we're able to get very intense with things. Obviously, the simulation lab is a safe environment and there's no real risk to the patients. They're all mannequins. They can be turned off and turned back on again, but we want to introduce as much realism as we possibly can, be it cutting clothes off of a mannequin, using an actual ambulance gurney, pulling out as much real equipment as possible to elevate that learning to help our students become comfortable in high stress situations that you may see out in the world as an actual doctor. We also have our operating room. This is a somewhat smaller operating room compared to a full operating suite, but we do have a full-size operating bed, and you can see in the bottom picture a whole host of operating tools, and our students are able to become familiar with an operating room environment, how to hand and pass tools around, how to use the scopes, how to glove and gown, all the kinds of things that you'll be able to implement your learning when you go out on rotations and after you graduate. And additionally, too, we have a couple pictures from our standardized patient events. Up in the top left, we actually were working with a local EMS. So this was their team and their gurney and their ambulance who transported this standardized patient to our emergency room to receive care. We can do things like in the center bottom photo where that needle is not actually going into that standardized patient, but they have a wearable that allows for injections and IVs. But it is a real needle, like I said, utilizing that real equipment. So our learners are able to interact with a human and still utilize real equipment. And that about concludes all of our spaces and what we like to do here at the Medical Simulation Lab. If you'd like to see a full catalog of all of our equipment, feel free to scan the QR code here on the screen. And if you have any questions or just want to come and schedule a tour with the lab, please don't hesitate to reach out to us at smart@westernun.edu. I'm Chancellor Jensen, and this has been a pleasure. Thank you.